Donna F. Edwards is the U.S. Representative for Maryland's 4th Congressional District. Representative Edwards' district includes most of Prince George's County, as well as part of Montgomery County. Donna is the first African-American woman to represent Maryland in the United States Congress. Edwards earned her first degree from Wake Forest University, where she was one of only 6 black women in her class. She attended and earned a law degree from Franklin Pierce Law Center in New Hampshire. Edwards co-founded and served as the first executive director of the National Network to End Domestic Violence, an advocacy and legal support group for battered women. She worked to pass the 1994 Violence Against Women Act. Donna Edwards continues her advocacy work every day, not only helping her constituents in the 4th District of Maryland, but fighting for justice and fairness for the poor and middle class on national issues. She will remind us that social workers can indeed play important roles in helping their clients to have an impact on political issues and social programs. Please join me in welcoming Donna Edwards to our NASW conference.
Thank you very much, Elizabeth, and thank you all very much for inviting me here today. You know, my first experience actually with NASW was when I was working on the Violence Against Women Act in the early 1990s. The association was actually one of the first on board supporting the Violence Against Women Act, understanding the need to connect services at the local level to battered women, to law enforcement, to hospitals, to all of the various agencies that women experience when they're experiencing domestic violence. So I want to thank you all for your long-term leadership on an issue about which I am very passionate. And in fact, I live out in Fort Washington, Maryland, and I remember the evening over a nice bottle of wine that a group of women from all across the country came together on my deck in Fort Washington and decided that we wanted to start the National Network to End Domestic Violence. Today it is one of the largest networks of anti-domestic violence organizations in the country, and all across the states their member organizations work in the states to affect public policy and social policy when it comes to domestic violence, to children who experience domestic violence, to making sure that the various services are in place that enable women to connect to their communities. Now, here I am in the United States Congress, and I'm going to tell you a little bit of a story about just yesterday, because it probably defines the way I view my role in the United States Congress and the way I see your role as advocates and supporters of people who can't always speak for themselves. And I hope that you view yourself in that way. So yesterday I was on Reverend Al Sharpton's show, and he wanted to have a little bit of a discussion about some comments that were made by one of the Republican presidential candidates, Newt Gingrich, about poor people and about poor children and about people who receive food stamps and people who receive and need other kinds of social services. And it was very disparaging of people who get up every day, many of them you know, who are poor but still get up every day and go to work. And sometimes they work harder than some of the rest of us because they don't just work in one job. They may work in 2 or 3 jobs. They're young people in their households who are teenagers, in addition to going to school, may also go to work to try to supplement a family's income and support. And he asked me what I thought about that, and I expressed my disappointment that anyone who would want to be President of the United States could speak so disparagingly about people who work so hard and who struggle so much. And in a country where we haven't seen the levels of poverty that we have in this country since the Great Depression, where the gap in income from the highest level to the lowest is higher than it's been in decades, where median incomes for the first time in this country have fallen below $50,000 a year. In this country where over 20 million children live in poverty, where in the United States House of Representatives earlier this spring, we unfortunately cut supplemental nutrition programs by 20% at a time when the demand for those programs has actually increased and not decreased. Just a couple of days ago, those of you who saw, I think it was the front page of the New York Times, saw that, in fact, for students who are receiving free and reduced breakfast and lunch and supper, that there is an increase in demand for breakfast and lunch and supper at school with students because their parents can't meet their family needs anymore. You know this because of the work that you do, and whether that work is at an academic level or it is directly serving clients or it is in the private sector or it's in the public sector, you know the truth of what people are experiencing all across this country. And I think that it is more important than ever before that we actually hear from your voices, because your voices represent perhaps the greatest and the deepest link that we have that's actually connected to the voices of people in all the communities that we live in all across the country. I think it's really staggering that here in what I view and all of us do as the greatest nation in the world, that we can have such inequality that people have to get up in the morning and they don't just worry about whether they have to juggle this bill or the other. They do that too. But they have to worry when they come home in the evening, whether they open up that refrigerator and they go to that stove, that they have something that they can put on the table for the people in their household. Where increasingly our seniors are living, who really haven't gotten a raise if they're on Social Security in a couple of years. Where if you are living on and you receive Medicare, that you know that essentially Medicare has been flatlined, but the cost for your prescription drugs has not been flatlined. And I know that in the 4th Congressional District, as I travel all throughout our congressional district, I know that there are people who are asking for services that never before asked for services. You know this as well. And so I think that we're at a really critical moment in this country where it's going to be important to refocus policymakers on things that actually make a difference in people's lives. And that the best voices to do that are your voices. And to help, I think to help policymakers understand that when you have an across-the-board cut in health and human services, when you have an across-the-board cut in the Department of Agriculture, when you have an across-the-board cut in the Department of Energy that provides energy assistance, that this is about real people's lives. And that there will be people going through this winter, and we just got a taste of winter. I mean, we thought it was spring last week, and then we woke up and we realized that it's December, and then it's getting to be winter time, and that there are people who have that thermostat way down. And what does that mean? It only means that we will see them in our emergency rooms. We know that. It means that they will be calling your phones, especially if you work for public agencies, saying, I need some assistance. But that assistance that you thought was there last year and it wasn't enough is decreased this year in this fiscal environment. This is a tragedy in this country. And so I think that you have a tremendous role to play in keeping it real, in helping us to understand the difference that what may seem to be, minor league programs and minor league needs are indeed major league needs to communities and to families. I go throughout our congressional district. One of the other things that I see, and I'm fortunate, my son came out of school last year. He's working because he found a job, and I'm grateful for that. But a lot of our young people who did everything that we asked them to do can't find a job. What does that mean for their families? It means that in a given household, not only is grandmom living in that household, mom and dad are living in that household, young adults are living in that household, households where a generation ago, even a generation ago, I know that my parents didn't have an expectation that I'd be living with them forever. I don't know that our young people now can say that same thing. And, so when you think about housing needs and trying to connect people with housing that they can afford, that becomes a challenge. These are all issues that you all come in contact with all the time. And one of the things about social work is that it is not just one sort of narrow little sector. I mean, you have tentacles in virtually every agency, in every part of every community, because it's what you do. And so you have a way of actually seeing things about ourselves that not all of us have the capacity to do, because we may only see one narrow piece of a problem. We may only see one narrow piece of a person's life. I know that in my congressional office, in our congressional office, we actually try to seek people who have a social work background. And why is that? Because when somebody, by the time they call a congressional office and they're about ready to lose their home, or they've lost their home and their stuff is out on a corner, they need somebody who has social work skills to be able to help them put together the pieces and enable them to rebuild their lives. When somebody calls our office and somehow or other a disability check was lost or miscalculated, they need somebody who has a social work background, who understands how to connect that so that they get their disability check. When someone calls our office and it's a senior whose child who was their support has just died, and that senior is now left on his or her own, they don't need me, but they need somebody who has a background in social work who's able to connect that. So I promised Adrian Christian, who is my chief of staff, that I would not leave this microphone also without making a plea. And it is that if you have young people who want internships, if you have young people who want jobs, we need social workers in our congressional office for those people who are losing their homes, for those people whose electricity is cut off, for those people who can't find a way when somebody else has to help them find a way. And so that's my plea to you. Some of you are teaching, and you have great, brilliant students who need to do internships. We're available, and I want you to make use of that opportunity. And then I'm going to close by saying, and I don't know if there's time to take a couple of questions, is there? Yes. I'm going to close by just sharing this with you. We're coming up on the end of a year, which is the end of a congressional session. We have multiple appropriations bills to get through to help fund various parts of the federal government. And my plea is also that you reach out with a big, strong, powerful, united voice to please communicate with our policymakers here in this town about the importance of what you bring to the table in communicating what the voices of ordinary people are and their needs in our communities. Because I don't know how much more in cuts we can suffer in these agencies. Maryland is getting ready to start its new legislative session at the beginning of the year, having to make up a $1 billion deficit. Last year, a year before, some of that money came to supplement our budget, as is true in every other state. That was stimulus money that kept people who are public sector workers employed, helping people, that made sure that we had energy assistance programs to get out to all of the communities who were experiencing difficulty, that made sure that we had emergency assistance programs in the event of a national weather emergency or other kinds of tragic event. And this Congress might leave town in December without dealing with those needs. And the only way, the only backstop to keep that from happening is if we hear your voices, and we hear the voices that are coming from all across this country to say, enough. And as we try to figure out, and all of us recognize that there are extreme budget constraints that every government faces, whether it's state, federal, or local, and that we have needs in this country where we're borrowing. But one of the best ways that we can stop that and prevent some of those needs is actually to invest in things that are going to create jobs so that people can pay for themselves and their family members. And so we have to invest in those jobs, create those jobs all throughout our economy. And in the meantime, we can't cut off unemployment insurance. In the meantime, we can't further reduce supplemental nutrition programs. In the meantime, we can't let families who are already at the most vulnerable position just lose their entire safety net and lifeline. And you all stand in the gap to help us understand what the problem is, how we need to fix it, and what we have to do. And so I'm going to urge you to make sure that you don't just get through what is a holiday season without making those phone calls and writing those letters and reaching out to legislators, because if we don't hear from you, guaranteed the damage will be done. Thank you very much.
Congresswoman, thank you for your comments. It seems to me that there's probably some congressperson, some Newt Gingrich-thinking individual in a room like this, somewhere else, saying something else. In your opinion, is there something else that might be said? First of all, do they get the same kinds of calls that you get about people whose situations are problematic, to say the least? And why would they not have a similar kind of perspective on an answer about this, realizing that the country is in the throes of this economic crisis? Or is it just about a political philosophy that says if we do it this way, then those people will be raised up as well?
You know, I do think that there are substantial ideological and philosophical differences between how the two political parties approach public policy. And I know that there are many people who, speak the language of we have to find consensus and, common ground. But I do think that it is important for us to note that that we have to actually have these policy debates and work through this ideological divide, because there's a difference between doing something the right way and doing it the wrong way. And that sometimes just because you reach or seek a compromise doesn't mean that you've done the right thing. We could find, for example, a compromise on Medicare, but it would involve significant benefits cuts for Medicare recipients. I think that if we are going to have that ideological debate, which we ought to have in the Congress, then it ought to be based on facts, and it ought to be based on, on the reality of what happens to people's lives. And somebody has to allow us the privilege of being able to have that conversation, and not just to seek a compromise just because we all want to agree. There are plenty of things over which we could all agree. It doesn't mean that it would be the right thing to do. And so some of us have to speak out in that environment. I will also say, just a reminder, that the poorest and the most Caucasian district in this country is the home of the senior appropriator in the United States Congress. Process that for a minute, because sometimes the story of who needs social services gets told in a way that it paints one community but doesn't paint the entire swath of people who have needs. And so I would love to be able to go to that legislator and say, by the way, people in your district need more supplemental nutrition and more assistance than they do in the 4th Congressional District in Maryland. What is the explanation that I'm supportive of making sure that those people in your district get the needs that they have, but that doesn't translate into you being concerned about the people in my district? Because truth be told, in the 4th Congressional District in Maryland, we are actually, even in this economy, we are one of the wealthiest congressional districts in this country. We're in the top quarter of congressional districts in this country. And so by all rights, our positions on issues actually should be reversed. But they're not. And so we have an obligation to help those legislators, continue to help them. I guess I come from a family that believes that, you know, we all need work. And so we just got to keep working them. And eventually, you know, people have to come along. And let's be clear, the American public is actually closer to where I am and maybe where many people in this room are. The American public actually does believe that a vast majority of us are sacrificing for a very small percentage at the top. And so our job is to help the political leadership have the same courage that the American people already have to understand that burden and to want to right that wrong. Yes, ma'am.
Do you think the Occupy movement has affected the perceptions on Capitol Hill?
It's such a good question. I stopped just briefly the other night to speak with the Occupy DC folks. And I think one of the things that's been said about them is that they don't have, you know, that there's no goal, that there's no leadership. And all of those things actually might be true, but why does it matter? Because the leadership needs to come from those of us who are in a position to make a change, to understand that, in fact, I think the 99% actually do get it. I mean, you know, it is not right. When I talked about the, you know, the declining median incomes, that isn't just a fact. It's a reality that people are living. We don't have to convince people of something that they are already experiencing in their lives. When we see the increased numbers of a demand for school nutrition programs, for school lunch programs, that is an experience that real families are having all across this country. The Occupy movement, I think, has helped to crystallize the voice for all of those people who are experiencing the difficulties that they are in their day-to-day lives every single day. I've said to some of my colleagues that we can't run away from an experience that, with few exceptions, the American public is experiencing. We can't run away from that. I can't run away from it because in my neighborhood, in my community, in my congressional district, it's the reality of people's lives. What we have to do as policymakers is to understand that and to fix the problem. And frankly, I don't understand the people who are so interested in defending this 1% up there, whose incomes, I was reading a statistic the other day, that the incomes for the top 1% in this country have increased 275% over these last several years, but the incomes for the bottom, and not even the bottom half of this country, have declined by 20%. That's not a shared sacrifice. It is a sacrifice, to be sure, but it's not a shared one. And so the Occupy movement, I think, is giving voice to what Americans are experiencing already. Our job as policymakers is to understand where that voice is coming from and to exact public policy that actually reflects the reality of people's lives. Yes, sir. Ma'am.
Do you anticipate Congress making any response to the expose on the abuse of foster children with the use of psychotropic medications that has been reported for the last 3 days as being a major national scandal?
I'm not sure. I mean, one of the things about being in Congress is that I serve on our Science and Technology Committee and our Transportation Committees, and only get to talk with my colleagues who are on the other oversight committees that have responsibilities for these issues. I fully would expect, though, that there will be a set of hearings on this. I mean, the numbers are just really staggering. And so I would expect that to be true. I can't recall that anything has actually been announced yet, but it's hard to, it's actually hard to envision that you find something like that that's reported that is so incredibly staggering and pervasive that it actually would not be looked into by the Congress. Yes, sir.
First of all, thank you for your progressive voice and vote in Congress. My next question is critical. I'm a news junkie, and I've noticed for years that the right wing and conservatives and Republicans write the narrative in this country, and they explain the whole economic downturn as a problem with debt, okay? Until the Occupy movement started, I didn't hear the Democrats coming out with a narrative that explained why we were in debt. Can you address that? Why that is? Why do the right wing have the narrative?
You know, I just came from another meeting at which somebody was saying something very similar. And I mean, I do think that that it is true that the right has been very sophisticated in finding very sort of pithy ways to explain very complicated things, and then to continue saying it over and over again so that even if it isn't a reality, it's perceived as a reality because it's been repeated so much. And that is why, for example, this the language that, and it isn't just Newt Gingrich, a number of the candidates who are running for president on the Republican side of the spectrum have articulated views about the poor and about working people that don't match fact, but that continue to be repeated, that demonizes people who are poor, people who are working people in a way that's been very harmful. I think now I want to be defensive in some ways of my Democratic colleagues and friends, because we have this vision of this really big tent, 1,000 flowers blooming, people speaking in a voice that's their own voice in a way that they want to say it. And I think that the downside to that is that sometimes, even though I may be saying the same thing as you're saying, it just sounds different. And the real downside to that is that it doesn't become part of the national lexicon. And as a result, it makes it seem like we're all over the map. Our values are not all over the map, but our voices are all over the map. I think that we've been, as a Democratic caucus, we've been having some real heart-to-heart discussions with all of us who span the spectrum from progressive Democrats to our more moderate Democrats about language that we can use and ways that we can talk about our values that is consistent whether you're in the 4th Congressional District of Maryland or you're in Western Maryland or you're in, Eastern North Carolina. And I think that that will be useful for us as we go through the 2012 election cycle. And let me just say that for me, the important thing is not the D or the R that gets put behind the name. It's what values get placed under those names. It's more important to me that we share values than that we share party. And if there is a way that we can find that we share values about understanding that not everybody is situated the same way and that people need different ways to move up, and that what helps for you might be different than what helps for me. I want to have that conversation with people who share an interest for the common good. And I will just close, and I do have to leave, by sharing this with you. When I was a young parent, I separated from my husband, and I was left on my own. I did have to go back to live with my mom for a brief period of time with my young son. And then I was able to move out on my own. But in those early and intervening years, it was a real struggle. I did like a lot of families do and juggled a whole bunch of different stuff. And I didn't want to call on my family because my father had recently died. And so it wasn't like, everybody was either emotionally or financially available to help out. And so I thought I can struggle and do this on my own. And what I knew that I needed, even though I was working every day, I didn't have health care when I was working every day. I couldn't meet my bills at the end of the month between student loans and rent and groceries and daycare, and you name the list of things. These are things, this is not unusual. My list looks very much like everybody else's list in this room. And occasionally, at the end of the month, I needed to go over to the food pantry and get something to supplement my food supply so I could feed my son. And when I did that, it wasn't a thing that, as a young lawyer, professional, it wasn't the thing that I wanted to do. It was a thing that I needed to do. Families all across this country make those decisions every single day because it's about themselves, it's about their families, and it's about wanting to make a better life. And that experience, even though it was a long time ago, it feels like it was yesterday. And when I hear the stories and the experiences of people in my congressional district who struggle like that as a policymaker, for me, it feels like yesterday. And it is what makes me redouble my effort, no matter what the other side is saying, to say we have to raise a different set of voices in this country and change policy so that it has a positive impact on people's lives. We should all redouble our efforts to do that, even when the noise sounds like, a disharmonic, is that a word? Chorus. Even though, and I'm a Democrat, and so I know that in that room we have a whole bunch of voices, and it just it sounds like a whole bunch of people who can't sing. And that other side feels like it is, yes, it really does, but it feels like it's a chorus that is, out of this world. So what? So what? Because in our communities all across this country, people are really, really struggling. And what I would like to see, I want the day tomorrow, whenever that tomorrow is, that a young mother with a young child doesn't have to struggle in the kind of way that I did. And not because she just wants somebody to give her something, but because she just needs a foundation so that she can then get on her feet and not ask for help anymore. And that's what families want all across this country. And so I thank you for the work that you do. So many of you, you really are on the front lines, whether you're on the front lines to helping us understand what the problem is, or you're on the front lines of dealing with people every single day who struggle in lots of different ways. And appreciate that. And do not lose your voices in this craziness. Amplify. Thank you very much.